Dr. B.K. Rana is the CEO of Quality and Accreditation Institute, former Director and CEO in charge of NABH QCI, Board Member and International Society for Telemedicine and eHealth, former Board Member for International Society for Quality in Healthcare, Chairman of Accreditation Council, former President of the Asian Society for Quality in Healthcare, founding member, Scientific Advisory Board, International Alliance of Patients Organizations, Chairman of Documentation Review Committee and member of Compliance and Appeals Committee of National GLP Compliance Monitoring Authority, Department of Science and Technology, Government of India, member of the Technical Committee of Ayurveda Training Accreditation Board, Ministry of Ayush, Government of India, team leader for the International Society for Quality in Healthcare External Evaluation Association, International Accreditation Program, International Consultation and expert for the WHO, World Bank, Asian Development Bank, International Society for Quality in Healthcare and UNFCCC. A warm welcome to Dr. B.K. Rana.
Over to you, sir.
Thank you very much for kind introduction. Good morning, everyone. Good morning. Thank you, Bhaskar, for a wonderful technical session. And now I don't have much technical presentation in my slides, hardly 20-25 slides, but I want more engagement with you rather than technical like Bhaskar. Thank you very much for giving us that. Can you hear me in the last line? I'm only talking to you, not these people. You are the most important people for me because you came in the last, right? You came because you were interested. So thank you all of you who were sitting in the last rows and standing. And thank you all which you come in front because you joined early. You wanted to be more informative and learning. So thank you so much. Thank you to organizers for having me here today for this Patient Safety Conclave 23, which is very important for everyone, not only for us, for patients, for relatives, communities, everyone around the world. And my topic is standards impacting patient safety. And Bhaskar was talking about lab safety, lab standards. My talk would be inclusive and exclusive, considering all types of standards in any healthcare facility, which can be leading to the issues related to patient safety and how they are connected. But before that, I want to tell you something, that how important communication is. And communication is one of the identified areas of patient safety. Do you agree with me? I can't hear. You already have breakfast, your glucose levels already up. Bhaskar has tested it in an accredited laboratory. So you should be of that level. I'll give you an example of today, the real example, how communication differs and can make difference in the lives of people. Sitting in the hotel on the breakfast table today morning, the boy came and asked me, would you like to take tea? I said, yes, tea with milk and sugar, everything. I thought he understood what I want. But when he arrived with a full kettle of hot milk, and then I realized he didn't understand what I was asking. He only bought milk. And I said, where is tea? I say, you asked for the milk. I say, tea with milk and sugar. And so he was nowhere. But in my understanding, when he left, I thought that he understood what I wanted. Exactly what it will happen to you all. But actually I was wrong. So I didn't confirm with him that do you understand what I want before he left. And he didn't ask me before he left. And that's what the result I have, a milk, hot milk. So I asked, give me sugar, give me dip, tea, and he brought, I made tea for myself. So my job is done, my work is done. But think the scenario. And this type of things happening every day, every second in healthcare facilities. You believe it or not, You accept it or not, it is happening. And you are all involved in it. Be a doctor, be your administrator, be the nurse, be paramedic, be any healthcare professional or worker, you all are involved in it. And we are doing all this every time. Am I right or wrong? Only he is, the CEO is saying yes. See, the CEO is saying yes, and all of us people are not saying even yes. Yes or no? If you say no, I am happy. Perhaps I would be the happiest person on this planet if you say no. Why? I would understood by that you are not doing any error in communicating things. But is that true? Is that true that you are not making any error while communicating? Error does not mean you are doing knowingly. It is happening. Like it happened with me in the morning. I didn't want to make an error. He didn't want to make an error, but it happened because of communication. So thank you very much for hearing me out on this. It was a real example for today, so I thought to share with you all, and it's really makes sense to connect with you. Now coming back to the topic which I have been given to talk on about standards. You know me because she very kindly introduced me who am I. But I want to make sure that you understand where from I come. I come from an organization called QAI. Sorry, I can't use it. This is digital screen, so this does not work. Say, it works here, but doesn't work here on the digital. It happens, so it's fine. So I have to say like this, okay? Bear with me. So I come from the organization in the corner, at the right top corner. Can you see? What is there? Quality and Accreditation Institute, which started in August 2017 as an accreditation body. We developed 14 standards in healthcare for accreditation. So very few of you sitting would be knowing about this small organization because very small at the moment. But we are trying to make a difference in the lives of people, our patients and healthcare organization through standards. Because the standards are the most powerful tool for making changes and improvement for patients. So this is we are, very small, but not that small as well. So we are 4 verticals for laboratory accreditation, for healthcare accreditation, for education and training, and for veterinary facilities, veterinary clinics and hospitals. For the first time in India, there were no standards for accreditation of clinics, veterinary clinics and hospitals, but we developed with the ministry's help. So I'll just brief you through. We work a program for laboratory accreditation. You know LABL, like Bhaskar was talking LABL in the morning quite a lot. So you know about that, but now you should know about QAI. We are also similar to NABL or any other organization around the world. We provide these 5 programs. ISO 15189 in the corner, which is the international standard for medical laboratories accreditation. It is an international standard. It's not an NABL standard. It's not a QI standard. It's not ALSHIFA, KIMS ALSHIFA Hospital standard. It's not a standard of an individual organization. It's the standard from ISO, International Organization for Standardization. ISO is the standard ISO 15189. Okay? Be clear in that. And that's my role as education and training. People should understand what they are talking about. So ISO 15189 is the standard for medical laboratories requirement for quality and competence, which is used for the accreditation of medical laboratories. And 2022 edition, the latest published last year in December, includes POCT as well. So now this standard takes care of whole ecosystem of medical laboratories. We provide accreditation to testing laboratories, calibration laboratories, and in addition to biobanking. 20387 in the corner right is the new standard published in 2017-18, and we are the first accreditation body in India and 3rd in Asia Pacific to start this program for biobanking. Very new program. We are internationally recognized by International Laboratory Accreditation Corporation, which means we are at par with any national, like NABL in India, which was the only one till now, and anywhere in the world which use the standard ISO 15189. So we are internationally recognized. You can have an option. Now you can go to NABL, go to QAI, or any other accreditation body which provide accreditation to ISO 15189. Now in healthcare, you know NABH. I was in NABH for donkey's years and started off in 2006 for the first time in India. But now this is our menu at QAI. We offer several programs. Some programs were already existing, but we develop very new programs. Our programs for our flagship programs are IVF. We have 50 applicants, IVF. Home healthcare is the second flagship program. For the first time in India, we developed dialysis center, standalone, hospital-based, green healthcare facility standard. They are very new, totally unique. And then, of course, hospital certification is not new. It was existing. Clinics, ambulatory, telehealth, again a new program, flagship program for telehealth services. Then emergency department, hospital accreditation, you all know. Transition care is a new program. Transition care, inpatient rehab center, de-addiction center, assisted living, senior care, 6 types of services fall into transition care. It's a new emerging area where patient is called out of hospital care. Patient come out of the hospital, don't go home, stay in transition care and receive long-term care. And then, of course, hospital. And then stroke excellence program, which we started a year back, and it's very successful program at the moment. So this is what we offer at the moment. And it's not just saying we are globally recognized by ISQA, International Society for Quality in Healthcare, External Evaluation Association, IEA. We are internationally recognized at par with NABH or JCI or AC or ACHS, any accreditation body anywhere in the world. We publish a journal, QI Journal for Patient Safety and Quality, free online, no charges for authors. You can publish your article without any charges. We are board member of International Society for Telemedicine and E-Health, which is an international organization. The good thing here is now the hospitals, dental center, eye centers, imaging center have options to go to NABH or to QAI because our program is accepted by CGHS for hospital empanelment as equivalent to NABH. Now, a couple of clients, Apollo, Max, many other, Practo, Continental, and the different programs which we are offering at the moment. Now, coming to the topic, giving the background, because that's all related to the standards. And now I'm going to tell you standards and patient safety. What do we know about the standards? Can anybody tell what is a standard? It's in a workshop, it's not a PPT, and then you enjoy listening me. And you are not wrong. You can say anything, you are absolutely right. So don't whatever you say whether you're right or wrong. So forget. What is standard? Standard protocols, okay? Structures, reference level. What is a standard? We are talking about a standard. We are eating, sleeping, drinking, playing standard every time. But what is a standard? Benchmarks. Yes, yes. Fantastic. So, standard is nothing but a framework of requirements for a purpose. For a purpose. And purpose can vary from this doctor to this doctor to this nurse to this nurse. My purpose of the standard is having a good clothes. His purpose of having is a good laboratory. Your purpose may be different. So it's for a purpose. You define some requirements with a purpose. That's about the standards. Now, it may be related to your structures, beautiful building, nice equipment, decoration, it can be related to that. It can be related to resources. And what resources in terms of personal, which you call human resources, individuals, facility, maybe equipment or any external services which you may use for your purpose. Purpose, keep in mind. It can be related to the processes. What you do in your healthcare facility. What processes, registration process, admission process, discharge process, surgical process, cleaning process, disinfectant process, So many processes, right? It can be outcomes. What is the outcome of those processes? Registration process, outcome is patient is registered. Discharge process, what is the outcome? Patient is discharged. Surgical process, what is the outcome? Surgery is performed. Those are the outcomes, right? Management system, we call quality system. You want to see how you are good or bad in some things. How you would know? You would know through implementing quality systems, right? It can be minimum for licensing or any regulation, right? So you, like Kerala has a Clinical Establishment Act, which defines standards for registration of a hospital or a healthcare facility before you start practicing healthcare services. So those are the minimum requirements prescribed in Act for registration or a licensing, right? So those are also standards. Or it can be optimum for quality improvement or accreditation. Many of you know about accreditation, right? Or quality improvement. So standards can be related to all these things, separate, or maybe together, correct? Now, what are the benefits? What are the benefits of having standards? Anyone? Quality of care, yes. You are not enjoying my talk? You are forced to enjoy it. Okay, you don't have an option for next 30 minutes unless you leave the class, but the doors are closed, and that is a standard. That is a standard you find that you cannot go out of the room because you want to listen to me, or you are forced to listen to me. That is a purpose. What is the purpose of coming here? You came here to attend the conclave. You define the standard for that. Oh, I am looking for 1, 2, 3, 4, 5. It comes to that, it's good. If not, it's bad for me. So what are the benefits? Yes? Okay, don't worry. It can be beneficial to public health. And I heard as I landed in the airport of Calicut, I got a message, Nipah virus in Calicut. Scary. I got another message now, Rana, you are in Calicut, be careful. You are coming to Trivandrum, don't carry it. Public health. But I'm sure the government, the regulators, the agencies are very, very strict, and they are very vigilant, and they are taking all the measures to contain it. But this is about public health, and there is a standard for controlling Nipah virus, containing Nipah virus, right? Do you agree with me or not? Yes, live example for safety. Whose safety? Mine? Yours? Everyone's safety. Environment and welfare of everyone. Environmental issues, you know. As I walking in, there was a lady standing with masks, right? I have it in my pocket. What this mask is doing in my pocket? Is it the right place? Where it should be? This lady is beautifully wearing the right place, right? So the mask is becoming like a helmet. Helmet place is here, but the most of the time helmet is here. Helmet is here. So same thing happening with this poor chap. Instead of here, it's gone to my pocket. It's not good. There are standards for it. How to use it, when to use it. But I'm not following the standards. So that's about environment and the welfare of the society, community, or everyone. That's defined by the standards. Now, support regulators and users, including patients. So the standards help regulators because you have gone for the licensing, for the registration of your hospital, which is good for everyone. End users, there may be many end users from healthcare facility. Patient is one of them, correct? Now, framework of standards in healthcare organization context. Now, I'm bringing down the whole set of ecosystem standards, standard for everywhere. Manufacturing, industry, transport, civil engineering, chemical engineering, food, any sector there are standards, well standards. Now I'm focusing on the healthcare context. What are that framework comes from? It talks about the governance. So this is a hospital, need to be governed properly. There should be a good leadership. There should be standards for that. How the leaders, the CEO, should be discharging his or her responsibilities through the management and the leadership. You have to have standards. And a standard not necessarily to be coming from some international organization. You can make your own standards. Very well. Nobody said that you can't make your own standards. You can make your own standards. So it's about how you run your organization, how you drive your organization. Okay? It can be related to personal. Many of you may not know about the personal, which is used in ISO terminology, but you know staff, human resources, mostly. So it's about all of us. We have standards for ourselves. Can a nurse practice without a license by the nursing council? Can a doctor practice without a state council or a national medical commission license without registration into it? Cannot. There are the standards for them. Okay? And you can make more standards as you move forward in a healthcare organization for different job descriptions. We all know our job descriptions. And job descriptions are not based on what I think. They are based on some standards. They are based on some standard, whether you call it accreditation standard, whether you call your own hospital standards, or you call the standard from the regulation or the licensing requirements. But they are based on standards. They are related to facility, and facility include physical infrastructure, the building, the equipment, environmental conditions, how much temperature, humidity, sterility, noise level, sound level, vibration level, anything which can impact my health, correct? Where I am in the environment of. It can be related to information. The most powerful tool is information, data, document, records, and by any means, whether it is electronic, digital, paper, verbal, any media, it's not restricted, and that's based on a standard. Correct? It's not something, there are standards for communication. There are standards for collection of data. There are standards for communicating the information with anyone else. And now we have Information Security Act. Now we have a Personal Data Security Act. There are many other acts which prescribe standards for that. Now, the most important thing about a standard is patient care. The patient in the center, patient care. How you identify a patient? There are standards for that. Can you say, I identify you by name? Your name is Dr. Rana. Am I identified? Am I right or wrong? And there are 3 Dr. Rana sitting in the auditorium. Now somebody at the door called Dr. Rana, and there are 4 hands raised up. And one of them walk out, and the person understands he is the right one. But actually he is not the right one. So what I have to do? I have to define another set of standards. Hey, age, Dr. Rana, 28 years old. And there are 2 gentlemen walked out with the same name, same age. It can happen. Then what I should do? So that only one person I am looking for should walk out. What should I do? I define another set of standards. The name, age, and sex may not work because both are male or both are female. Then some unique identity, right? Some third thing, some unique identity, whether you give me as a hospital or I define as my passport number or my Aadhaar number or my driving license, which definitely going to be different, not going to be same. Even there are 1,000 people with same name and age, but they are going to be different. So I have to define 3 sets of standards, correct? To correctly identify me as a receiving care from you so that you don't make errors, correct? So that's about identification. Diagnosis. I have to have standards for diagnosis. And Bhaskar was talking about diagnosis. Based on anything by examination, physical examination, mental examination, psychological examination, or behavioral examination, or testing, or imaging. Any sort of exam, I need to have a standard for it. Agree? Okay. Then diagnosis and diagnostics, of course, testing, medical laboratory, or a diagnostic imaging. Then invasive procedure or surgical procedures. I need to have a standard for it. I can't just open up an abdomen and say, here I am, give me scalpel, give me scissors, I cut it. Now I have to follow a procedure for performing a specific procedure or a surgery on a patient. I can't do without that procedure in my hand, without the standard in my hand, without knowing those standards. And it's in non-invasive procedures as well. There are invasive and non-invasive, surgical and non-surgical procedures, both inclusive. Then nursing care. The most important standards required for the nursing care. Why? Why? What's silent? Should I come to each one of you and say, hey, can you tell me please? That's why I took this. Give me the flexibility. This is the standard I said before I was coming to the stage, that I want to be flexible so that I can move here and there. I can go to anybody to talk. I just don't restrict myself to the podium. That was the standard I set for myself for this talk. If I would have not set, I say, oh, they have already set the standard. I have to go and use this podium, click, 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 and finish. Thank you very much. Any questions, please? That would have been a standard prescribed by the organizations. They would say, I don't have this. I don't have this. I would helpless. I would have been staying. Standard by them. So I prescribe my standard, and luckily those got fulfilled. So I'm lucky enough. Okay. So nursing is important because as nurse, you are with the patient at the most of the time. Most of the time, you are with patient, nobody else. Not doctors, no paramedics, no family member. You as the nurse. And that's nursing care makes a lot of difference for the patient's outcome. So you have to follow your standards. Whatever standard, I'm not going to into detail what standards you follow. And then, of course, medications. Who are responsible for medication? The pharmacist, clinical pharmacologist or clinical pharmacist, and the team, the nurse involved, preparation, dissemination, and all, administration. So whole sort of medication management, starting from prescription to giving it away from the store or pharmacy, and then going in preparation and then administration. All the stages and steps of medication process. Everything you have to have a standard. You can't go without a standard. Can an orthopedic surgeon prescribe Brufen? That's all. Can you do this, sir? Cannot. He has to say Brufen 500 mg 3 times a day. And somebody has to follow this. Correct? You can't say Brufen 500 3 times a day. You cannot say in all cases. You have to set a standard. When you can say, when you found that patient deserved that dose. You have doses, okay, pediatric dose and adult dose. General concept, pediatric dose is this and this, but actually it's based on the weight, the body. Even for adult age, a patient weight 30 kg, which actually falls under category of pediatrics, but actually adult age, the medication might work, or the other way around. You can't prescribe a 50 kg, 12-year-old kid the same medication as you prescribe for a pediatric patient. That may not work. You have to have a standard for it. And that's why you calculate, the doctor calculate, okay, weighty bird, this, finally this. Infusion, this much, this milligram per liter every hour. Based on some calculation, comes from where? Standards. You can't just use your own knowledge, of course. And then rehabilitation, transition of care. Transition of care is very important within and outside hospital.
within hospital, surgery department to medicine, medicine to surgery, surgery to orthopedic, orthopedic to gynecology, gynecology to radiation. There may be transition of the patient within the facility. You need to have standards. You can't just say, oh, today I'm not feeling good in this. Can you send me to the ophthalmology department as a patient? Can you send me? I come to the orthopedic surgeon. He says, I'm not feeling happy here. Can you send me to the medicine department? You say, I cannot send you because my standard says you have to stay here. You have a knee problem? You get operated. After 2 days, I will take care of you. I can't send you medicine unless you really want to go. But my opinion, clinician is this, is the patient choice. There are standards. Do you agree, sir? And the last line, you are with me. Say this like this. Thank you so much for having with me here and here with me. Yes, I can see nobody sleeping. We have a standard for that. Right? 6 hours of sleep, this much of time, take break. Don't continuously work with the patient for 16 hours. Otherwise, patient will be somewhere else and you will be somewhere else. Staff breakdown. There are standards for that. People give an example of aviation pilot cannot work for more than these hours. He had to take a break. Same thing is for you as a staff. Because you have the most precious thing in your hand, the life of a patient, life of human being. You can't just, and COVID-19 pandemic has taught this all to us. Correct? The staff safety is as much important as the patient safety is. Because if the staff is not safe, patient is not going to be safe. If the staff don't have a confidence in his mind or her mind that I am safe, let me focus on patient, they cannot deliver the right care to the patient. And that's what happened during COVID-19 pandemic. That you have to provide as a CEO, PPEs, whatever is required, whatever is supposed to be there, so that the staff can focus on patients, for the patient safety. So staff safety is as equivalent good as patient safety. There are standards for that. You can't go without standards, okay? Education, patient and family education. There is a prescription in the discharge summary. Patient go home. Patient don't know what to do. Patient can't read your prescription. You have given in English. A patient knows Malayali. What to do? There are standards. How to write a prescription. That's come from the education. Do you know English? No. But I don't know Malayali. What to do? Not the problem. We have standards. We have to write prescription in a manner, in a language, patient and oblique or family understand. Clear? You have to write prescription which is correct. TDS, BDS, HS. I don't understand. I don't understand, right? At night, 3 times a day, 2 times a day, once a day. In a manner and language, there are standards for them. Correct? You can't just, and pardon me, I have been to many accredited hospitals and I am part of it all. Still people write the same thing in the prescriptions. I can pull out any prescription for any hospital name, you will find writing these. Despite we have standards. But it's not the fault of the standard, it's the fault of us, we are not following them. We can't blame the standards for that. The standard exists. Only the practitioners are not there. Okay? So education is most important thing to tell patient, this is the medication you have to take like this. Take with hot milk, hot water, before meal, after meal, give a break. Education about medication, about their own health and well-being. Don't smoke, go for a walk, spend time with friends, go outside. All education for the well-being of the patient. And of course, last but not least, is the follow-up. How you follow up with your patient. That's part of care. Your care does not stop till the patient was in a hospital. Your care continues even a patient goes out of the hospital. Correct? You can't just say, oh, no, I am not responsible. You are responsible. And we are standards for follow-up. Having standards, well-defined standards for follow-up. What happened to it? It's being educated. Yeah. Coming to the second part. The first part is standard. Second part is patient safety. How many know about patient safety? All of you know patient safety? Everyone knows patient safety? Very good to see the people with mask. Not on the chin. Not on the chin. I want to keep everyone wake up, not to sleep. Okay? So patient safety, everyone knows? I think nobody knows patient safety. That's why you are here to learn what is patient safety. That is my understanding. You prove me wrong. Correct? This is my perception, and perception may vary from person to person. And that's what the patient safety is, a perception. My perception of patient safety is what I just mentioned. You don't know anything about patient safety, you are here to learn. But your perception may be different. I am an expert of patient safety. I just see here how I can contribute to the patient safety. I am here to add to my learning and knowledge. So there may be different standards and mindset and perceptions of patient safety when you are here. But actually, what is patient safety? In a language, patient safety is a framework of organized activities that create cultures, processes, procedures, behaviors, technologies, and environments in healthcare that consistently and sustainably, and see the red part. The green part is good, happy. The critical part start now in the red. Lower risks. Reduce the occurrence of avoidable harm. Avoidable harm. Okay? Make errors less likely. There may be, but less likely, and reduce impact of harm when it does occur. Very powerful sentence. Okay? Very powerful sentence, because this is all in our hands. Completely in our hands. And even sometime it goes out of our hands, it says, still you can control. Try to minimize the damage. If something already happened, you can still control, pull back, and make your system more robust. So why I say so is lower risks to your patients. Okay, put all those processes, procedures, technology in place which can help you in reducing risks. Reducing the avoidable harm, it means whatever data, I have not put any statistics, 90% of these, 70% is known to you. You can go to Dr. Google, you can find all the statistics. So I didn't put any statistics in my presentation. But it is being said, hundreds of thousands of medication errors, hundreds of thousands of medical errors are happening around the world every day. And I'm sorry if it is happening around the world, we are not excluded. We are part of it, including this hospital. Any healthcare facility, any state in India, any country outside the world would be definitely contributing to it. From somewhere the data would be coming. Okay? Those are unavoidable harms. Very much preventable harms. We all can prevent those harms which are happening to patient. And that is the most important thing. The things which can be prevented, why we are not trying to prevent it? Rather than continuing to do all those errors which we don't want to make ourselves, definitely, they are very much avoidable. And if they happen, how we can reduce the impact of that error on the patient.
How you can reduce the impact on the patient? Anyone want to try? You are not looking at good students. You are not responding to, or I'm a poor teacher, for example. I can take that as well. Yes, how you can help in reducing harms to your patients. The last one. Reduce impact of harm when it does occur. Ho gaya. Finish. Done. Wrong surgery. Done. Wrong patient. Done. Wrong dose given. Wrong route allowed. Wrong identified patient. Wrong test already happened. How you can reduce the impact? You can't do anything what has already happened, but you can certainly do something in future. And that is what we are looking for through standards. That the standards help us, all of us, so that we should not going to repeat it. We are not going to again doing the same thing by reporting them. You need to report. Needle stick injury is the most common example I can give. You don't report and you suffer as a staff. You don't report because you have a fear in mind that if I report, my administrator will say, tomorrow you are not coming to the hospital. Sorry. You don't report. You put on the carpet. Near misses, right? Incidents. They become sentinel events when you don't report because they get accumulated over a period of time. And these small errors, incidents, accidents blast into sentinel events. We can very much prevent sentinel events if we start reporting and acting on those near misses and incidents and accidents. And that is how the patient safety is all about. It's not a magic thing, it's not a rocket science, it's very much doable thing. If we think we can, we certainly can. Now, WHO response to patient safety specifically, for last several years, patient safety is one of the global agenda. And the World Health Organization is the leading agency in patient safety as far as human health is concerned. I'm sure you all know. So 2002, World Alliance for Patient Safety was set up. I don't know whether you know about it. I assume, and I'm sure the 50% of you don't know about it. Big challenge, 50%. So I thought it will be good for at least 50% of people to get to know about it. And then 9 patient safety solutions were developed around 2005, 6, 7, 8. 9 patient safety solutions. And then launch global patient safety challenges. So WHO launches global patient safety challenges, 3 global challenges so far. Can anyone give me the name of the first global patient safety challenge? And there is an award for it. You will get 1 day free training from me. Okay, I am extending the award. You will get a free 1 day any QA training which we organize in future. You can sign up, you say, I responded correctly, I'm entitled to free. We'll give free. It may cost 5,000, 10,000, we'll give you free. Anyone? See, my guess was wrong. I thought only 50% maybe not knowing, but it is 100% not knowing. So I saved that money for QA for not giving award. But still I'm continuing with the award. If still somebody want to try, even wrong. So that's, and this is not, please keep in mind, it is not the criticism. It's not let you down. That if I'm saying you don't know, I'm letting you down. No way. I have no such intention. You are as competent, professional as anywhere in the world. My only purpose here tell you is to educate you all. We are into healthcare. And imagine if these 100 people or 200 people sitting don't know what may be the situation in the whole of the nation. And if you go beyond the boundaries of the nation, think what may be going on around the world. If this much of percentage of population of healthcare workers don't know about it, so you can assume it is same thing happening anywhere in the world. So we are not exclusive of it. So good, thank you so much. Let me tell you what are those. The first was clean care, safe care. All you do hand hygiene. You waste a lot of soap and water. You waste a lot of sanitizer. Correct? We do practice, but we do not correctly practice. We do wear helmet, but we do not correctly wear helmet. 50 to 60% of the bike riders do not put the strip. So you wear it, does not wear it, makes sense. You hit, your first thing go out of head is the helmet before your body got out the bike. Not correctly wearing it. Same thing is, we do hand hygiene, but not properly. So we waste things, okay? So first was clean care, safe care, which is hand hygiene. And second, safe surgery saves life. Safe surgery saves life. It's gone. Safe surgery saves lives, which is use of, what you do in the surgery? Surgery checklist. Use of checklist. Time out, time in, or one, whatever it is, okay? So safe surgery saves lives because surgical errors were a lot of things for patients. And infection, you know, is the most important and happening thing in healthcare facility. And third is medication without harm. World Health Organization realizes medication errors are the most significant contributor towards medical errors. Total medical errors, the maximum coming out from the medications. Can you believe it? Doctor sitting here, sorry for that, the nurses sitting here, pharmacists sitting here, we are making good number of errors every day in medication, whether it is prescription, whether it is second stage, giving away from the pharmacy, dispensing, and third, administration. So these are the things which every day happening as a source of errors for patient and harming the patient. And that's why the third Global Patient Safety Challenge, Medication Without Harm, 2017 it was launched. And it says no, check, harm. No, check, ask. No for patient and doctor, for both. Know your medication before you take. Know your medication before you write. Check. Patient, check before you take, and doctor, check before you give the prescription. Ask. Ask doctor, ask the patient whether writing it correctly, and patient should ask doctor if he or don't understand correctly. No, check, ask to prevent medication errors. And then of course, then patient safety curriculum multi-professional. So WHO had developed a curriculum which patient safety has been included in there. And the Patient for Patient Safety Initiative, which we are talking about today, as one of the theme for this year's Patient Safety Day, International Patient Safety Day, which is celebrated, which was started first time in 2019. So this year is the 5th year. And when it is happening? Today? 17th of September is the World Patient Safety Day, started in 2019, and Patient for Patient Safety Initiative actually started by WHO long back, but this year engaging patients for patient safety. But it is extended, engaging patients and families for patient safety, because many times patient is not in a condition to get engaged, right? Not in situation. There may be many clinical situations. So that's about, and the recently Global Patient Safety Action Plan, which is a decade of patient safety, launched in 2021, 2030, a decade of patient safety. This is the major decision of the world political leaders in World Health Assembly last year. They launched is next 10 years of patient safety, which include all the components which we are talking about. There are 5 strategies for patient safety as defined in Patient Safety Friendly Hospital Standards of WHO. They are leadership commitment, clear policies and guidelines, standards, okay, the standards. Competent and compassionate health professional, competency and compassion for the health professional. It's not just competency, but compassion is also inbuilt. And then engaging patients and family. So this is not today only. This has already been realized long back, and these standard patient safety friendly hospital standard were launched by WHO EMRO in Cairo office first time 10 years back. Okay? Using data to drive improvement. So whatever data, information you collect, use it for improvement. Don't keep it with you. You collect data, quality manager, every month, every quarterly collect data and look at it, do something and keep it. Use it for improvement. I'm not saying everyone doing it, but most of them are doing like that. So this is the whole 5 strategies for patient safety. And this is not just the end, it's the beginning. Okay? This is what the overview of the Global Patient Safety Action Plan 21-30. This is the, what are that? One vision, a world in which to 100 million healthcare and every patient means safe and respectful care every time, everywhere. That is the vision of this document, which is endorsed by all the member countries of WHO in World Health Assembly with mission, with a goal, single goal, right? And have basically the 4 partners in action. The 4 partners, the orange color is government, healthcare facilities, stakeholders, and WHO Secretariat. These are the 4 major partners in action and 6 guiding principles. These green pillars, 6 green pillars actually. 6 green pillars are actually the guiding principle. Patient and families as partners, results through collaboration, data to generate learning, evidence into improvement, policy in action, scientific expenditure, and patient experience. So these are 6 guiding principles, and there are 7 strategic objectives. 7 objective policies to eliminate avoidable harm. So healthcare facility need to have policies in place. And what is a policy? It's a standard. Policy is not something, it's a standard to avoid harms. High reliability systems. So your healthcare system should be reliable, resilient, not changing with small impacts. Should be quite reliable so that patient can rely on. Should be resilient, should not get affected by small changes. Safety of clinical processes, surgery, whatever you do, clinical processes. Patient and family engagement is one of the important things. Then health worker education, skills and safety. Healthcare workers' skills and safety. Both are inclusive. And then information, research and risk management. And the last one is synergies, partnership and solidarity. Solidarity is the one word which WHO GG was repeating during COVID times, that we have to be coming together, work together for everyone together. So this is, you can download from WHO website. You can just Google it, you will get it. You need not to write down. You can just download the whole document. Beautiful document. You read it, you will enjoy it. Say, look at it. Patients are people. Most of the time we treat a disease. Patient come to the doctor and patient, okay, what is the problem? Headache. Treat the headache. Now 10 patients with 10 different body weight comes to you and you treat the same way. All 10 patients. No, it's not good. These 10 patients are 10 people, 10 person, individuals. They may react to medicine differently. It's not your assumption that I'll give you paracetamol 100 mg, 500 mg, and it will work accordingly as you think. May not. Because you are treating a disease and you're considering everyone in the room same as human being, one patient, not individual person or people. Okay? So you say we are not numbers on a spreadsheet. We are real living people with lives, loves, friends, and families. Okay? So this is about treating a person, not a patient. Okay? Why it is important? Because transition of safer care is very, very important. What does it mean? It means you know a patient. You treat a patient for the disease. But the world has already moved up. It has gone beyond. It talks about person or people-centric care. Patient-centric care is good, but going beyond is person or people-centric care. It definitely includes patients. Patient is not excluded out of it, okay? But now it is going further beyond, is patient and family. You just can't take patient in isolation because patient is not in situation to listen your commands, can't read, somebody to help, any care provider, caregiver has to help. So families are into a picture. And then obviously is going beyond patient, family, and community. And this is the real patient-centric care. This is really person or people-centric care where your patient in the center, family and the community around. Because there are certain things which you can't alone. Had it be a COVID-19 pandemic or similar pandemic or Nipah virus or something, can you as a patient or a family do alone? Until the whole community come together, say, listen, from tomorrow 9 o'clock in the morning, everybody going out have to have the mask on proper place. That's the commitment of the community. You sitting at home as a family cannot do anything. So community is important. Healthcare is not about going into hospital and get treatment. It's about everyone. And that's why communities are very important, particularly for public health measures. And that's why I call it transition for safer care. Okay? We have to change our perceptions about patient safety. We can't keep patient safety concept as we have been thinking before, or maybe before you walk into this hall. Now your perception must change that patient safety is not just a patient, but it's patient, the family, and community. By the time you look at it, it's about 4 scenarios. If you look at the first picture on the top left corner, is about, I'm having trouble breathing. What do you get out of it? Any message? Anything you want to say? Feel free to say. What do you get out of, what do you get the first impression about it? Okay, don't worry. Go to the second one, second picture. Look at carefully and tell me what you get out of it. Come on, guys. You can't be sleeping like this. No proper equipment. Okay. Fine. I can take part of it. Anyone else? I said nobody is wrong. Everyone is right. Whatever, even the most wrong thing you say, that also will right. Don't worry about saying. Say something. Communicate with me, please. That's my idea. Communicate with me. See how encouraging it is. Yes, boss. Structure and facility. Very good. Distractions. Ducks are distractions. So fish, poor fish. Where is the real environment to the fish? Is the water. She will definitely feel breathlessness. Now the doctor will treat her or him for breathlessness. But actually the problem is not breathlessness. Breathlessness is because she is not in water. If she is in water, she will have real problem coming to the doctor. But now doctor is going to treat about, and he will send to the cardiologist. And he will do the job. And he may say, oh, I have done angiography, nothing I think is done, but now your option go for stenting or CTBS, you know? CABG, poor fish. With little headache in the fin is going for cardiac surgery. See, the same thing with the second one. No proper equipment in the environment he or she is. Because there are distractions. They say quack, 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 and he is hearing. What is hearing? The real sound of the heartbeat or chest sound with the quack, quack, quack. So not a real equipment, not the ideal environment. And this is happening. Now you can correlate all these with your real situations. In your hospitals, your healthcare, they are very much correlated. That's why I put all these things. They are very much highly correlated with the real examples and experiences. Go to the third one. What is that? So I can read it for you. I'm sorry you can't read. So like, what does it actually do? Looking at the telephone on the table. And she's saying, I use it for finding my smartphone. So she used this landline phone facility for finding out her smartphone. If in case he lose, she dials and he get ring ring and he get it. What message you get? How to utilize right? So it's a misutilization of the equipment. You are not using the facility appropriately. You are doing something else, and that is happening in healthcare. Healthcare is not an exception. Not updated or not doing the thing as you should be doing. Go to the last.
Go to the last. What is this? Seizure inside the body. Obviously, after surgery left. Patient complained of the chest pain, brought up, X-ray done, and this is found. So why it happened? You didn't use the safe surgery checklist. You will say, I did use, sir, this is the checklist. Yes, you did, beautifully written, but you actually not used it. You just filled it. You just filled it. The nurse in the OT just filled it after everything is done. After everything is done, patient walked out, surgeon gone home, smoking on the top floor. And now the nurse is filling very diligently. Every time, check in, check out, time in, time out, everything, count done, everything. Count is also done. Scalpel, this seizure inside. Count complete. Because that was not really done, it was just filled up. And healthcare this is healthcare. And these are not hypothetical situations, these are real situations. Right? Okay. Now, coming to the end of my talk. I said my talk was standard related impacting patient safety, and I showed you one slide, and I'm repeating the slide on top. That was my slide on standards framework. And then I switch over to patient safety, the second part. The slides I showed here, now you can correlate both. With my first slide on a standard, you can very well correlate with patient safety. Is something which I mentioned in there is not appearing here. If you find out, I'll give you an award. See, I have everything for award, to encourage you all to talk, speak, learn, share with me, teach me, make me educated. I'm open for all these things. So what I'm saying, this standard are impacting patient safety. And what I mean by saying the standard are not responsible for patient safety. If you don't use standard properly, or you do not use standards, you will impact patient safety in a wrong way. You will harm patients. You will not increase the level of patient safety in a healthcare facility, but you would decrease. And that's why this whole slide, to make you understand the correlation. This is QS brainchild, patient for patient safety. It was started WHO long back. There was an Indian, some chapters, but 4 years back, I thought, why don't we start in India? And now we have Patient for Patient Safety Foundation India, already registered trust and working on driving the patient safety for patient safety agenda. Now, before you enjoy, and let me drink some water, and my throat is dried, so you enjoy and tell me what is this all about before I say thank you. You enjoy the slide and tell me what it is. I put it because I know I need to drink water, so I can give some time. Anyone? Any comment? Yes, boss. There is third person. Can you see? You can't see. You are assuming. She has got a point. Okay. So you are assuming there is someone inside. Very nice. Good. Huh? The wardrobe is thinking. You are super intelligent. You make a wardrobe speaking, thinking. Fantastic, man. You will be a champion for patient safety. Yes, I identify one leader. Anyone else? All of you should say something. I am not going to leave till you say something. Sorry, organizers. Tell me, relate to patient safety. I did not put it like that to enjoy you. Think. Hi, honey, getting informed while waiting for me. This is his perception. This is what he thinks. That she is reading a newspaper and what he says is related to that. This is his perception. His thinking. What she says? You can't change what you don't know. You understand what she says? You can't change what you don't know. And this is precisely happening with your patient. You can't change what you don't know as a care provider. So what you have to do? You have to got to know. And the third one, what he said in person inside, he's thinking maybe a voice recorder or a tape recorder there. I don't know. Maybe Almira talking. It is also possible. We don't know. So there is third one which is invisible. We can just imagine there is someone. Obviously there is someone in this case. There is a man in this case, obviously. Right? And that's why he is saying, she got a point. Because this person don't know if there is someone inside. Actually, his perception is she is reading for him, waiting for him, and inside actually there is someone. So this is what is happening in healthcare. We think what we think. We think we are right, but actually that's not the case. There is a patient, there is a family which thinks differently. And beyond it, there is someone who actually get the benefit or the losses at the end, has something different to say, which is community, which is the whole of the environment, everyone around in the healthcare facility. So there are different perceptions, and people think what they find themselves in a comfortable situation. What you feel that you are doing right, or what you want to do right, or what you're doing actually is right. This is individual's perception, what we think, ladies and gentlemen. Thank you very much for giving me this opportunity. But before I leave this stage, is this statement. Very powerful one line. If it is not safe, it is not care. Dr. Tedros, Director General World Health Organization, said this statement in one of the assembly. If it is not safe, it's not care. How powerful. You have to think as a healthcare provider. Thank you very much, ladies and gentlemen, for giving me this opportunity and listening to me.